Charlotte's going to help us demonstrate what happens when students transfer weight to the supporting leg, but can't keep the pelvis functional over that leg. So we're going to ask Charlotte to demonstrate what happens when students transfer their weight and hitch their hip, and then when students transfer their weight and drop into the hip, neither of which are very functional for the classical dancer. So just turn around and face the back wall. Charlotte is standing in parallel. So what we would normally do is find those dimples. They're a really good bony landmark for us. And then we'd keep our fingertips on the dancer's iliac crest or hip bone as well. And that should stay quite level. When we ask Charlotte, she's going to transfer her weight to the left foot, lift the right one up to hip height, and relax. Nice. So now we're going to ask Charlotte to hitch this hip when she transfers. So off you go. Hitch and lift. Yep. And you can see what's going on, Charlotte. You can relax so you're not in that awful position. You can see that the erector spinae are really overworking. They're going to become tight, and you're going to start seeing some compression into the lumbar spine if the students hitch like that. The other mistake, if you like, that we see, or non-functional alignment of the pelvis, Charlotte, I'll ask you to repeat that, but if you would drop, sit into the left hip for me. So and drop. That's really, really common. Come on up. Once more gently, just drop. The muscles that control, back to neutral, that control that neutral pelvis or neutral alignment lie over this lateral hip. So they are gluteus medius minimus and your tensor fascia lata. Just relax for me. So if the student is sitting in, which is far more common, the injuries or the injuries that we might see relate to some discomfort in the groin, because if you're dropping in, you're compressing through here into the front of the groin. You're also stretching that big, long iliotibial band over the greater trochanter. And lying between those two structures is a bursa, a little fluid-filled sac that allows structures to glide comfortably and friction-free over each other. So just drop in again for me, just sort of sit in. Yeah, if you're sitting in and you're dragging that over that greater trochanter and bursa, thank you, you can start to irritate the bursa. Worst case scenario is perhaps a bursitis. And then we're also have the potential to see some shearing through the sacrum, the joint that's made with the sacrum and the ilium, so into the sacroiliac joint, or dragging through into the lumbar spine. So sitting into the pelvis, that left-right lateral, either hitching up and jamming up into the lumbar spine, or dropping down and tractioning all these structures, both have the potential to lead to injury for our classical dancers. How do we fix it? We make sure that gluteus medius minimus and the tensor fascia lata, so the AB ductors, can work to stabilise the pelvis over the femur when a student moves to a single leg. So if you would just lift that right knee forward again and stay stable, beautifully aligned, stable pelvis, Charlotte can now do whatever she wants, développé devant, à la seconde, whatever she likes. Thank you very much.
So bringing exactly what Deborah Cruikshanks was saying about the dangers of sitting and letting go on the supporting side, whether it be one way or sitting the other way, that lengthened spine can be felt in this simple développé exercise with the bands wrapped as we do in PBT. So I'm going to ask Charlotte now to lift out of the supporting side as she takes the développé. Keep lifting out of the gluteus medius and that's it, and the fascia latae, the tensor fascia latae, lengthened and close. Right? Go for the quality rather than the quantity. Then the legs can go higher later on if that's pure. Now, Charlotte, can you do that again and then sit in your hip? So you sit down into the hip. Oh, okay, close. So we really want that lifted out of that supporting side, almost like the weight is centered right over the front of the foot, and we lift out of that gluteus medius there, okay? Now, one more, and let the rib cage go this way, because this is very common. Up, and the rib cage going, and you see the hips misaligned. Right, so that's the danger. Can you correct from there? Lift, don't sit, just lift. Feel that lift there, beautiful. And the leg becomes light. So really go back to basics. Don't worry about the height. I know with today the Insta fame, how high is so important to so many young children. But if we don't have the purity and the basics first, we have nothing to build our technique on.